I'm Sally Pace, the CEO of Connect Healthcare Collaboration, and we're an employee benefits marketing firm that focuses on driving engagement. Our team built the Granite List, which is a platform designed for benefits leaders to easily search for and source innovative solutions like Wellnecity. We also have a business line that delivers exceptional employee engagement through clinical advocacy, and we're proud to support the plan members at US Radiology Specialists. We're thrilled to have both of these partners on the webinar today to discuss shared successes. The reason we're here today is to really look at how data-driven solutions can address health plan challenges. And we're going to talk about how specifically Wellnecity empowers both groups to reduce costs, streamline operations, and enhance outcomes. Will is the VP of Total Rewards, Payroll, and HR Operations at US Radiology Specialists, who has firsthand experience, and we'll just dive into this in a little bit, navigating rising costs, fragmented vendors, and the struggle for ROI. And he'll share how he and his team have turned things around. I'm also joined by Paul Richmond, who is the Chief Commercial Officer at Wellnecity, who's been helping companies take control of their health plan through data-driven solutions. Our plan today is to walk through how we have a better understanding of why healthcare costs are spiraling and what the biggest cost drivers are and where the biggest cost drivers are hiding. That will be really key. We'll hear real-world insights from HR leaders like Will, who've successfully reduced costs and improved outcomes. And then we'll end with actionable strategies for using data to regain control of your health plan without adding more to your work plate. I know that sounds great to everyone. So with that, Paul, I'm going to start with you. And can you start by painting a picture of the current challenges employers face with their health plans and why these costs continue to rise despite efforts to manage them?
Yeah, absolutely. Thank you, Sally. And thank you for hosting this webinar. I think Will probably has a better perspective on this than me because he lives the challenge every day, but I'll speak to what we see whenever we talk to our customers and the work we do with them. The health plan management is really difficult. To paint the picture of how difficult it is, I'm reminded of when my wife and I were newlyweds. We loved putting puzzles together. One of them, aptly enough, was named Young Love, and it was a painting by Norman Rockwell that depicted two young kids holding hands, and in the background is just a totally white background. It's like a 500-piece puzzle, and it was so difficult. It was the end of my puzzle days. Now imagine that same puzzle being 1,000 pieces and we're missing half of them. And that's probably the best analogy I can make to help people understand how difficult this is for folks. So we have, as you mentioned, rising costs. You have a fragmented system. There's a constant battle for ROI, but like to get really specific about that, it's coming from all angles. It's not just about the rising cost of chronic conditions and, obesity and diabetes and cancer. It's the cost of also providing the care to support the members who have those conditions. I talked to one health system in Georgia. They described to me that their nursing costs alone increased to over $400 million from year to year, from 21 to 22. So it's not just that the conditions are getting worse, the cost of providing care is getting worse too. One of our customers told us that they're spending $1 million just in managed diabetes care. It feels like they're chasing costs instead of managing them. We talked about the fragmented vendor ecosystem. Nobody in the space is really talking to each other. It's like a tangled web. And if we had a visual of all of the different disparate point solutions and the connection points required to manage a health plan, you would see it could be literally up to 100 different data connections. And there's no reason that people aren't talking to each other because it's really difficult to make those connections. And then thirdly, the constant battle for ROI. If every vendor in the space delivered on the ROI they promised, healthcare would be free because they're all taking credit for ROI, and there's no way to manage the attribution of all that ROI in a really clear, transparent way. That's where we come in. But the impact of this on our customers is staggering from a spend perspective. For a self-funded employer with 5,000 employees, their plan spends somewhere in the neighborhood of $60 to $75 million. For a self-funded employer with over 10,000, we're looking at 120 plus to 150 million a year. These numbers are staggering. But then also it comes to challenges of just managing the plan. You have some customers with 20, some customers with 60. We have one customer with over 100 data connection points. And each one of those represents its own unique challenges. And each one of the point solutions, they want to communicate with the population. They want to run their own special programs to maximize their engagement and utilization. And it is a huge burden for the health benefit leaders. But one of the biggest hidden drivers of the cost is just waste and inefficiency. What we see constantly is that somewhere between 5 and 10% of savings can be found in just managing the vendor stack better, providing the oversight and holding vendors accountable. We can save customers $3 to $7 million a year for companies of these sizes. So with that, we're looking at tremendous opportunity for us to provide the tools and the expert guidance for customers to really take control of their health plan spend. And that's what we're so excited about. And one of the reasons why we love the partnership that we have with Will.
Well, so Will, you're on the receiving end of all of this. This is your world. Can you take us back a year and describe where you and USRS were sitting when you came into this space and what your frustrations were within the benefits arena?
Yeah, absolutely. And thanks. That's a great question. Hey, everyone. Thank you for attending the session today. I'm Will Foster. And as Sally mentioned, I lead total rewards for U.S. radiology specialists. First, I'd like to just talk about U.S. radiology. As many of you probably haven't heard of us, since we operate under different provider names really across the U.S. So we're made up of physician-led radiology practices and outpatient imaging centers, which was founded back in 2018. Our creation really began with an acquisition of a physician practice. And since then, USRS has acquired mainly for growth, but it's had some organic growth through just new center openings, increasing volume. We have around 5,000 employees and physicians, and as you can imagine, a very diverse workforce. When you think of just the income differences, the benefits needs, and as you might have expected, our medical plan is self-funded. Like many of you on this call, at some point, you've probably seen double-digit increases in funding or costs year over year. Well, that was us, well, at least until we brought in Wellnecity. But some of the cost increase was related to the richness of the plans through just increased claim cost coverage to accommodate, our certain population needs. But what we found, really most of the costs was related to really no insight into how to actively manage the healthcare plan with data. And so what was really a worse feeling was feeling like we couldn't do anything about it, even after several months into the plan year. In many years, that's when you're already seeing that, things are trending higher. So I'm sure many of you have felt this way, or maybe even starting to feel this way in 2025. So when I think about, why Wellnecity was a smart decision on our part, like many of you, frustrated, feeling trapped, within the year, and when trends are started off higher, tired of high single or double digit increases, tired of passing those increases, along to employees. And for us, to make matters worse, our physicians have to pick up the cost on the employee side, but also, kind of the full benefits costs. And so we don't want to mess with the design too much, because again, we've got a broad spectrum, that we need to cover in our dynamic workforce. And so we felt like we needed something, more than what a broker plays. And, we really wanted a curated approach to our problems and what we wanted to solve for. So we decided to give Wellnecity a look and see if they could really help us. And yeah, we were always getting data, but it was looking in the rearview mirror, wasn't really, solution oriented, wasn't, what like curated solution for what we needed to solve. And, like you all, I wanted to know options at various cost items that were popping up throughout the year and how to provide better outcomes for our members. And at the same time, I don't want to add yet another vendor to manage and basically something to report, on 3 to 6 months, based on last year's data. So that's where I see Wellnecity as a real extension of our team that we needed and still need going forward. Tell me about my problems, give me the solution, the options, and then manage the vendors to deliver on the savings or better outcomes for our employees that they promise. So Sally, I was frustrated, but now since we've had Wellnecity on, for over the last 2 years, we've been able to deliver real savings and no longer feel like we're having to shift cost around or shift costs back to our employees.
Thanks, Will. And, you talked about real savings. So, Paul, I'm going to throw it to you to have you talk about some real examples of how those savings occur.
Yeah, absolutely. So to understand how we do this, I think it's important to try to just frame up what Wellnecity is. Wellnecity is a purpose-built streaming data platform designed to provide actionable insights at the moment of need, like I said, in near real time. So we do that in three ways. There's three things that we do. The first is the data insights. The second is fiduciary and financial control. And then finally, vendor oversight and management. So digging into each one of these data and insights, most platforms will take in data. Will talked about this. They were getting a lot of data, but one of the things that we do that separates us is we take in all the data from every source, then we unify that, and we create a consolidated view of everything that's happening in the health plan. That allows the health benefit leaders to see what's happening in their plan, and then we can identify opportunities and provide actionable insights that they could use in the plan year to make decisions. We look at things like how the health plan compares to industry standards or best practices. We look at the administrator PBO programs and asking the question of what impact they're having on the plan. We're looking at things that they could do that potentially ask for in different contract negotiations in the process to improve their performance. And this is kind of low-hanging fruit stuff that is like the first step of the journey of working with us, but it's impactful and we bring real results. We had one small customer that we worked with that saved over $700,000 in stop loss premiums just from the simple desk audit we did in our first encounter, even before they were a customer of ours. They already paid for their services, and that's just the first step in the journey. Fiduciary and financial controls, we look at things like, do the invoices match the agreed terms and are the claims paid within the timely filing deadline? Are our customers overpaying for infusion drugs? Are the claims being paid accurately? Rebate calculations for the PBM, are they done correctly? We've saved one customer over $2 million in moving costly, unnecessary hospital-based infusions to a different location. And we had another example where we caught a $1.2 million discrepancy in the rebate calculation for another customer's PBM. These are some of many, many examples we can list, but they're just representative. And then finally, where we get into the vendor oversight and management, we really help our customers to reduce waste and inefficiency in their vendor ecosystem, streamline the vendor transitions, minimize disruption should they decide they want to make a change, because we sit as a hub and we keep all the data, which makes it really easy for a benefit leader to replace an underperforming vendor. But we also help them optimize those solutions. We drive utilization, and we monitor, to your point earlier, about the performance of all of these vendors in the stack, and we really make impacts within the year that make a difference. One example is we had a Fortune 500 customer who switched PBMs, and at the end of the first month of the new PBM being in place, we identified that they were 25% over their forecast and the trend. We worked with the customer and the PBM to solve that problem, and by May, we had them back on track for the forecast. That's timely, actionable insights that really made an impact within the year, and we didn't have to wait for planning season to see what went wrong and what we could do to fix it. And I think that's a really powerful way that we can partner with our customers. But what really sets us apart, as Will mentioned it earlier, it's our commitment to not just highlight problems, it's to come with solutions and then to monitor those and make sure that whenever you implement our solutions, that we're getting you the results that we promised.
Well, and that's a perfect segue, because, Will, we talked a little bit about where you were a year ago, but can we talk about where you are now and the results that you've seen?
Yeah, absolutely. I hope everyone is getting excited seeing this slide, Sally. I think we've seen great results in a short period of time. Look, 2 years really isn't that long in the benefits world, at least not to me. but I mean, here it is, 2 million in total plan savings, which has been a great accomplishment. We no longer see the year-over-year increases like we were seeing, before, and even in past companies where I've been. And we spend less time managing vendors. And so now our time is spent really understanding the plan quarter by quarter, watching what is happening in the market. And our time is now being much more strategic with Wellnecity. Now, I mean, Wellnecity takes ownership of driving the outcomes with the vendors and shares, with us, how the vendors are performing. And that's not something that's, really ever been done before. It's almost like you got to staff up a team to manage vendors, and then you never know if they're really doing and providing that ROI. So now what's even better is we're taking the savings and just reinvesting it into the plan. So back when you think about like our workforce and our dynamic workforce, we've got to really, double down, because radiologists are in high demand, technologists are in high demand. So we can't erode the value, of our benefit plan. So, I mean, this is the money slide to me. I mean, this is what I like to showcase to my finance team, my finance partners, and CFO. It's been great to share internally that we actively manage our plan, versus we will discuss changes in the annual enrollment, annual benefit strategy meeting, and then kind of set it and forget it. And so that's definitely something that's been a very pivotal change, here at USRS, is that we're now actively managing the plan, no longer seeing year-over-year increases, and able to kind of invest back in and make sure that our plans across the board are competitive for our dynamic workforce.
And so, Paul, can you talk about how this plays into some of the broader industry trends that you've seen?
Yeah, absolutely. What Will experienced before partnering with us is what we see with customers across the board. That's not, unfortunately, it's not something that's specific to him. Employers of all sizes are dealing with these pharmacy spikes, unmanageable vendor ecosystems, and the compliance risks. I know everybody's familiar with the CAA and the increased scrutiny around the fiduciary responsibility of the benefits leader. And we give them the data and the power to manage their plan in a way that protects them from concerns about litigation there. So we're seeing a huge push in terms of proactive plan management. And like Will said, benefit leaders, they don't have to just react anymore. They can take control, and we're finding more and more benefits leaders who are wanting to take control of their plan.
And, Will, I know we all talked about and looking at those that signed up in advance for today's webinar. It is a big mix of benefits leaders across the spectrum. So you have a chance to speak to them. Like you said, it's many people that look and feel a lot like you. What would you say?
Yeah, I mean, don't feel stuck in your decisions or budget that you set last year, or during your benefit strategy meeting last year. You've got options. I know many of you are probably planning your 2026 benefit strategy meeting over the next couple of months. Talk with your broker. If you're not thinking about it now, I mean, start thinking about, what a partner like Wellnecity could do for you, and kind of pull that in with, your existing broker relationship. If you feel your team is tied up managing a bunch of vendors and you're not really seeing the real dollars, or you don't feel like you're reporting on, really any savings or honestly any better outcomes, for last year or the year before, you got options. I mean, Wellnecity is a partner that's really taken all vendor management off of our plate. In fact, they're the ones that kind of vet the vendor and then offer them to us as like, hey, here's the problem we've identified with you, and here's the solution. So, if you're tired of passing along increases or tired of plan tweaks, there's solutions out there. And I mean, look, data is great. Reporting the news is interesting, but so what? What are you going to do about it? And so, Sally, I mean, that would be my advice, knowing what I know now and what we've accomplished with Wellnecity.
So you brought up pulling in the benefits consultant, and Paul, I know that's a crucial part of the work you all do as well. So can you talk about how Wellnecity works alongside benefits consultants?
Yeah, absolutely. It should, and in most cases is a very complementary relationship. They have a broad perspective on everything happening in the benefit ecosystem, and we are really deep and heavily focused on data. We view ourselves as tool that they can use to help their customers be more efficient and save money in their plan. We have great relationships with a lot of brokers and consultants, and we even have a position where we don't want to talk to smaller employers without going in with a broker or a consultant, because it's just a much more synergistic relationship. So we really appreciate our partners in that space, and we look to strengthen those relationships.
And Will, kind of as we're coming to a close, will you talk through what you're working towards? What does the future state look like with Wellnecity?
Yeah, I mean, we're very much more data driven. We're much more focused on, kind of like what's next, and are the vendors and delivering on what they said they were going to deliver on, and how do we continue to challenge ourselves to have a world-class benefit program and keep the budget flat. So that's the challenge, right? And that's the CFO. That's the challenge the CFO loves for me to have, because he doesn't want me to have to say, hey, we need to increase by 2 million, to USRS. So that's what we're working with Wellnecity is moving towards that, monitoring, the member outcomes, with some of our vendors. And, again, just, I really look forward to, a year or 2 more years to see that money slide, what happens to it, because I think it's going to continue to grow in savings. And I'm going to be able to talk more and more about success stories where, our members, our employees are having better outcomes.
Absolutely. So, to that end, we know that Wellnecity simplifies the health plan management, cutting costs, improving outcomes. It's a data-driven solution that works. We saw it with the stories you shared, Will. Thank you for sharing what USRS experienced and the real savings that were accomplished along with the streamline operations, and then the proactive strategies for the future. Because I think we all agree, I think no one would be on this call if they didn't believe that the days of just accepting rising costs were still around. Those days are long gone. And so I know I'm going to have to take this down in a minute when we switch to Q&A. So audience, this is your chance to get the e-guide on 2025 Health Plan Revolution, Achieving True Value Through Smarter Health Plan Management, and also to snag Paul's email address up here on the screen. And I'll type it in the chat in just a second once we get the Q&A going. Will, what were you doing to manage vendors before Wellnecity, and what pushed you to make a change?
Yeah, so was not managing them well, and in fact, in some ways, kind of steered away when vendors were brought up, because whether they're cold calling you, they're brought forward just through conversations with brokers, etc. So we had a few, we really weren't paying attention. They'd put time on your calendar and it was always at the worst times. And so, that's kind of before, and one could say, well, it's up to you to hold them accountable. But I think many people that sit in the same seat realize, there's so much time in a day. But, because Wellnecity sees this, they live it, they breathe it, they're able to, really hold them accountable to the T's and C's, but also they've got all the data so that they can compare and say, this vendor's doing X and here's the actual ROI or the savings, or not, because a lot of the vendors speak in generality and they'll say in my book of business, portfolio, or whatever, and there's not anything specific to you. So before, barely managing at best, try to stay away from having to manage and wouldn't sign on vendors, to now we've got a lot of different vendors, great vendors at that, and it's all managed by Wellnecity.
Paul, well, I'm going to address, there are a couple of questions or comments that have come in. We did get that the QR code is not taking you, to an active link. We will send that corrected out at the end of the webinar. But then following that, Paul, this one is for you. How does Wellnecity exactly monitor the vendor stack? What are you looking for?
Yeah, so as I mentioned earlier, we take in all the data from every source. And then what we're able to do then is identify where members interact with the health plan throughout the ecosystem. And we really actually monitor every transaction. So if you have a member on the health plan, when they interact with the medical carrier, we see that. When they're interacting with the PBM, we see that, or any point solutions, wellness programs, if you have that and you want us working with you on that. So we have the ability to see every interaction and see the performance of the members who are engaged with vendors and how they compare to the folks that aren't. So if you have a point solution for MSK, for example, we can see how their results compare to those who don't go through the program. And it just gives us the ability to get really granular, and we could support a lot of really cool clinical navigation, as Sally and her team know, because we are really getting down to the granular level and monitoring everything that happens in the plan.
Another question back to Will. How many enrolled employees does USRS have on their plan, and are the $2 million in savings over the course of 1 year?
So $2 million in savings is over 2-year period. And USRS is roughly around 5,000 employees. We've got about 65% of the members of our employees are actually members on our plan. So around 3,200 are actually actively enrolled in the medical plan.
This goes back to Wellnecity's monitoring and ROI. What is the before and after PEPY after implementing Wellnecity? Paul, I'm gonna let you. I think that's a. Before and after implementing Wellnecity, and I think that's probably more. I mean that's based on plan design, right?
Yeah, it's gonna depend on plan design. It's gonna depend on how rich your benefit ecosystem is. We can speak to averages. As I mentioned, we save our customers between 5 to 7% in terms of total overall spend. What that translates into from a PEPY perspective is going to differ by plan. It's going to be affected by the plan design. Will may have the numbers for USRS top of mind, but you know,
I wish I was that good, Paul. I mean, I like numbers, but I can't remember all of them. I'm happy to, if I have Charles Adams, contact information, I can kind of share more with him directly. But what I would say, just kind of in general and more specific, Wellnecity is a curated approach. So it's not like they come in preset on every plan, right? Because every plan's different, every company's different, blah, blah, blah. So it's really a kind of a curated approach. But there's definitely going to be savings to be had. I can assure you that.
Next one, lots of discussion on savings, since that is the cornerstone for Wellnecity. At what dollar amount triggers a review by Wellnecity? If you're able to watch every transaction, can you share what dollar threshold you will trigger a notification for your client?
Yeah, so this ties into exactly what Will just said about the way we work with our customers. We have our own default where we will generate a member of interest report at $5,000, where we have a member that has $5,000 worth of spend on the plan. We don't just track high cost claimants, but if you have a different threshold that you want to see, we can work with you to set those alerts and be proactive on those. But that's one of the things that we work with our customers to define at the beginning of an engagement, so that we can identify folks who are who are trending towards becoming high cost claimants and intercept them and get them plugged into the right program so that we can head that off.
Okay, another question for you, Paul. How does Wellnecity's work differ from the work a benefits consultant does?
As I mentioned earlier, when we talked about our relationship with them, we're just the data. Like, we're deep in data. We give them insights that are very difficult for them to get because we know how to go collect all the data from all the different data sources. And we serve up the insights that we find, and then they use their expertise and their understanding of the ecosystem to, work with their customers to do the work of implementing all of the programs and working with the solutions.
Okay, another one on cost. Will you notify the stop loss carrier for the clients for someone at the 50% of attachment point?
Yeah, we will absolutely share that information. And kind of just philosophically, we will share all the data that we have with the vendors in the ecosystem, and we'll work on behalf of our customers to make sure anybody who needs the data has it.
Okay. I think you've been pounded about cost savings, ROI. I think, Will, you've done an exceptional job of of telling the real life story of how it's played out for USRS and how it's really just getting started. So guys, I know we were hoping to keep this at around 30 minutes. We went a little bit over, but we've gotten some great questions in. So if there are no more, then I'm going to thank everyone for their time.